I'm a student nurse. I'm here to give you an IV. I'm going to go ahead and wash my hands really quick. And can I go ahead and get your name and date of birth?
Heather Bomar, 7991.
And then do you have any allergies?
No.
Okay. So I have here today a saline solution of D5W. So I'm going to go ahead and verify it to my MAR, and I see here I have dextrose, D5W, and I've checked the expiration date, the color and clarity. Everything looks good. So right now I'm going to go ahead and spike it. So I'm going to go ahead and put it down. I'm going to go ahead and make sure my roller clamp is closed before I do this. Okay. Close this. So I'm going to move it over the top. Down, right?
Yeah.
Okay. So I'm going to go ahead and remove the cap, making sure this is completely sterile before I spike it. Okay. Go ahead and hang this. And now I'm going to go ahead and flush the tubing. So I'm going to make sure I get all the air bubbles out. I'm going to go ahead and fill this up halfway first. 2, 3. So that's halfway. So I'm going to go ahead and slowly release this. You could remove the cap if you want, but just gravity, so you want to go down. Okay, making sure all the air bubbles are out. Go ahead and clamp that off again. Go ahead and wrap this on here. I want to keep that sterile. So I'm going to go ahead and wash my hands again. I'm going to go ahead and prep all my, touch my hair. I'm going to go ahead and get all this stuff prepped over here. So the next thing I'm going to do is prep my extension tube. So carefully open this here. Make sure it's clamped. So I'll go with this one. So I'm going to go ahead and make sure I get all the air bubbles out of this one. So I'll just put a little bit of saline. Just make sure. See, this is good. At this point, I'm going to go ahead and remove the cap and place it back in here, keeping it completely sterile. So that would be in there. I'm going to go ahead and place this close to my patient. So I don't need that anymore. I do need that. So I'm going to go ahead and wash my hands. I'm going to go ahead and set up my tape before I do this. Then I would have all my labels ready too. We can do that later. Okay. So, have everything here. All that. So I'm going to go ahead and wash my hands once again. And then I'm going to go ahead and hire the bed up to my working height. I've already introduced myself to the patient. So I have here orders to go ahead and give you an IV with a saline solution. See, it's for dehydration to help hydrate you. Do you have any questions before I get started?
No.
Okay, so wash my hands. I'm going to go ahead and put on my gloves. Now, is there a preferred site that you have? Left, right arm?
Either one's okay.
Okay, and then I'm going to go ahead and check for any mastectomies, dialysis, shunt grafts. None of that stuff. Okay. So the first thing I'm going to go ahead and do is I'm going to go ahead and place a tourniquet on you because I want to find the correct vein, make sure we have a good vein.
Note this would be on the arm and not the neck.
I'm going to make sure this is super tight before I do this. I'm going to go ahead and tighten this so I can engorge the vein. And I see here I have a nice vein, so I'm going to go ahead and take my alcohol swab right now and go ahead and clean that off. And then I'm going to go ahead and chlor prep it. I guess you could do it at this point. But I want to be careful not to touch it. I'm going to go ahead and release this while this dries because you don't want to leave the tourniquet on for longer than 30 seconds. So I'm going to go ahead and make sure everything's set up. So I have here my 20 gauge needle. And then at this point I'm going to go ahead and rotate this 360. And then, because you can't.
Good job.
So I see this is, go ahead and, it's already dried. So I'm going to go ahead and replace my tourniquet. so I'm ready to go ahead and insert my IV. Alright, so I have a 20 gauge needle here, and you're going to feel a little prick. It's going to be a little uncomfortable. You've already got that. So, I'm going to do it this way. I'm going to go at a 20 to 30 degree angle. And on the count of 3, you're going to feel a little prick. Ready? 1, 2, 3. Go ahead and insert until I see red, pull blue. So I see red, pull blue. I'm just going to go ahead and go in a little further. Go ahead and insert. And I would go ahead and click my safety button at this point and discard this. But we won't want to do that. And I can go ahead and insert my, not touching it, keeping it completely sterile. Not touching my surgical site, keeping that in place. So that's good. At this point, I'm going to go ahead and insert the saline solution. And that shouldn't be clamped. So I'm going to go ahead and insert it, looking for filtration above the catheter. I don't see any, so that's a good sign. So at this point, I'm going to go ahead and tape it down. So I'm going to go ahead and tape this part down so it goes, so I can stabilize the So I'm keeping this still, not touching the surgical site, and I can see I'm not touching it, so that's good. So I can go ahead and release this. So I can go ahead and put on my Tegaderm. I'm not really going to put this on.
You can just...
And before putting this on, I would make sure I have the date, time, gauge of the needle, and what else? My initials. So I'm going to go ahead and place the Tegaderm over the pink part of the catheter. So that's good to go. So we'll leave that there. We'll see that's on. I'm going to go ahead and disconnect this so I can go ahead and tape it. So I would go ahead and stabilize this some more with some more tape here. Don't want to get that. Okay, at this point I'm ready to go ahead and insert my dextrose. So I would go ahead.
Does that need to be sterile?
Yeah, I'm going to sterilize this first.
Okay.
So I'm going to go ahead and clean this for a good 30 seconds before hooking it up. So I've sterilized that. Am I missing anything, guys?
No, you're doing great.
Nope.
Okay. So we go ahead and remove this. And I've already sterilized this. That cap doesn't matter. If I touched that, I would go ahead and sterilize that for 30 seconds. But I didn't. So that's good. So now I see I have that in place. I can go ahead and set my drip rate here. You ready to set my drip rate?
Yes.
Okay, so I would put my watch up here, and we're going to say it's 20 drips per minute, so I want 5 drips over 15 seconds. So I'm going to slowly put my watch up here and watch this. And we'll say we got 5 drips over 15 seconds. So how are we doing over here, Mr. Berry? Any pain?
I'm good,
Anything
no
like that?
pain.
Everything's good?
Mhm.
Okay, so I'm going to go ahead and remove my gloves at this point. I'm going to lower the bed first. And then I would check my IV 30 minutes. Nice 30 minutes, and then every hour lower the bed, and then I'm going to go ahead and wash my hands at this point.
Okay.
Did I miss anything?
Nope.
Okay, good.
You did great.
Now do you want to do your order for discharge?
Yeah. Okay. So
Okay, now you have a discharge order.
Okay, so knock, knock, knock. I'm Mr. Berry. My name's Chris. I'm a student nurse. I have here orders to discontinue your IV.
Okay.
Can I go ahead and get your name and date of birth?
Mr. Berry, 7991.
Okay, and then do you have any allergies, anything like that?
No.
Okay. I'm going to go ahead. I would have already washed my hands before I came in the room. I'm going to wash them again. I'm going to go ahead and put on some gloves, and I push the bed up to proper working height.
Okay.
So I'm going to go ahead and set up my tape first to make sure I have my gauze. Tape there. Did I label everything too?
I don't know if that was the only thing I don't know if you did. I don't know that you labeled the
Yeah, I did
solution or
label.
the tubing.
I would have labeled the solution and tubing with the date, time, and initials.
Yes.
So that's all on there. So now I'm ready to discontinue his IV. So I've washed my hands, raised the bed up, and I have here my... So I'm going to go ahead and make sure this is all clamped off before I do anything. And it should be clamped off already, so that's good. I'm going to go ahead and disconnect this piece right here. This up here. So,
Should be clamped.
yeah, let's make sure this is clamped off too. So I have my gauze here ready to go. So I'm going to go ahead and take one of my alcohol swabs to slowly take off the Tegaderm, and I want to start from the corners and work my way towards the middle.
So it would be that thingy that was on there.
Yeah, so take the Tegaderm off with the alcohol or chloroprep, whatever you have. Not keeping the IV site sterile, and you still don't want to touch that IV site. So go ahead and remove this tape here, keeping this super. Okay. All right, I'm going to go ahead and take out your IV now, so you'll just feel a little pressure. So I'm going to just go ahead and put this over the surgical site, not putting any pressure on it. I'm going to slowly pull out. I'm going to go ahead and check my catheter, make sure it's still intact, and I still have the pieces, so that's good. I'm going to discard that in the sharps. And then I'm going to go ahead and hold pressure until I see no more bleeding. Place a piece of tape there. And then are you having any pain or anything like that?
No.
Okay. So I'm going to go ahead and lower his bed, take off my gloves, wash my hands. I would document that I discontinued his IV, date, time, initial, anything else?
Should be it.